Neuro-rehabilitation was the main reason for our coming back to the previous hospital, but lots of investigations were prescribed to analyze how the other internal organs of the patient were working. As a precautionary measure to protect against infections, the patient was kept in an isolation ward close to the ICU. Chest X-rays were done and lung infection was detected. It was diagnosed as a hospital-acquired virus. My son had on and off high temperature. We were told this is common for stroke patients who are on tracheostomy, as they would not be able to cough out the microorganisms. The first priority was to cure this lung infection. He was given heavy antibiotics for 21 days. Nebulization was given thrice a day to ease breathing and also lessen the phlegm in the chest area. Tracheostomy secretions continued and suctioning was done once in every 2 hours. The affected eye could not blink on its own. The ophthalmologist examined and declared that the cornea was fine. To avoid drying up of the eye moisture, an ointment and eye drops were prescribed. The eye had to be taped shut all the time. To avoid bed sores, the patient was made to sleep on an airbed. Since he could not move on his own, the nurses and housekeeping staff used to keep changing his sleeping position once in every 4 to 5 hours. As far as physiotherapy was concerned, on a daily basis, 2 sessions of 1 hour each were fixed, during which his limbs were exercised and connected nerves were stimulated, and chest clearing therapy was also given to bring out phlegm and bacteria. The next on the list was a kidney function test. Once in every 15 days, catheter was replaced with a new one. In spite of all the care taken, urinary infection showed up. Temperature variations due to fever spikes was a matter of continuous concern. Heart and kidneys were working satisfactorily, but lungs were not working to their full capacity yet. A video laryngoscopy was advised to check the status of lungs to see if tracheostomy removal could be facilitated, but it was still a long way away. This depended on a lot of other parameters like tongue mobility, swallowing, etc. Tracheostomy suctioning was an extremely painful procedure. Sometimes it used to draw blood along with the secretions and would leave him completely exhausted. We were given a long diet chart by the dietitian. Since only liquid feeds were being given, the patient had to receive sufficient nutrients every day. My son had to wear a Philadelphia collar, foot drop splints, elbow braces, lumbar and knee braces to keep the limbs in correct position. By the end of September, slight movements began in the left leg and hand, which were weaker than the right limbs. He was made to sit in a slanting position with pillows all around for support. The physiotherapy was showing positive results. In the month of October, he started feeling sensations in the body. He could feel body pain and started showing it through facial expressions. Neck muscles regained strength. Head was able to stay upright and also move comfortably. Once a month, we had to get a follow-up review at hospital number 3 and had to hire an ambulance along with oxygen and emergency nursing care. The ophthalmologist confirmed that the affected eye has not lost its vision. Slight eyeball movements also began, but since both the eyeballs were not synchronizing in their movement, the patient had double vision. We were told that perhaps the vision will get corrected automatically once the blood flow to the brain improved. But again, this could not be assured and no time frame could be predicted. By the end of October, the tracheostomy tube was changed. A new smaller one was inserted with an external corking system. This would help in the tracheostomy weaning procedure. By closing the tracheostomy tube with a cap, which is called corking, he could breathe from his nose, which in turn helped to produce sounds as the air would pass his vocal cords. Involuntary swallowing also began, but mouth muscles were still locked, hence he could not speak or eat as yet. There were new developments every day, some were positive and some were negative. Slowly, physical movement started improving. Communication also got better because though he could not speak, he was able to point out letters on the alphabet chart and spell the words. A little later, Once motor skills got better, we got him to practice writing the alphabet and numbers. In the beginning of November, slowly oxygen was weaned off. Corking and uncorking the tracheostomy tube at regular intervals helped in producing sounds. Mouth opened to about 1.5 inches width. Tongue became slightly mobile. After a few days, he was able to form words which were rather slurred and slow. The name given to this condition is dysarthria. Swallowing got better, secretions became almost nil. Next priority was removal of Ryle's tube and tracheostomy tube. So, the weaning process began by feeding jelly-like semi-solids which were easy to swallow. As mouth mobility improved, solids would be given at a later stage. We were told that liquids were last on the list and clear water would always result in choking and aspiration even up to 6 months. Bladder control was also improving. Tests were conducted to check renal functions and the catheter was finally removed. Limbs started moving freely. My son was taken out in a wheelchair after 3 months of confinement. An audiologist conducted some tests and told us that hearing in the right ear is almost nil. In about 8 to 10 months, slowly hearing might or might not improve. There was no immediate treatment which could be given at this point. Stimulation was given to jaw muscles and eye-related nerves twice a day. Slowly my son was able to sit up and even stand with a little help. By the end of the month, he was able to walk with a walker for support. We began tutoring and training him on his life skills. He started learning to do his personal daily tasks on his own. Since the fingers had got back their strength, he was taught to hold a spoon and eat, hold a pen and write, brush his teeth, wash himself, and so on. After 3 complete months of hospitalization from the day of his stroke, my son was discharged and sent home in November. He had lost a solid 15 kgs of weight. The tracheostomy tube was removed, but he still had the Ryle's tube in his nose. So liquid feeds through the nose had to continue at home. We were also told to continue physiotherapy, speech therapy, and occupational therapy. Monthly reviews at both hospitals were mandatory. Correction of vision and hearing had to happen on its own as and when sufficient blood supply to the brain resumes. The doctors explained that the stroke suffered by my son was pretty bad initially and there was absolutely no hope. But he had responded well to the medical procedures and shown great improvement. Anyway, there was still a long way to go for him to get back to his normal life. To meet the hospital expenses, our relatives, friends, and even many kind-hearted strangers helped us financially. Many healers from different modalities began sending him distant healing. My son's current employer also extended a lot of support. The Divine was showering blessings in many ways, and we shall forever remain grateful to each and everyone who helped us in our difficult phase. My son's homecoming was surely a miracle worth celebrating. The doctors had trained us well on how to manage the patient on our own, but still, deep inside, we were worried and anxious. At the hospital, the medical staff were just a shout away. In case of any emergency, will we be able to handle the situation? Watch the continuation video. You will find the link in the description box. Your likes and shares will help us. Please like this video, share with others and subscribe. Thank you.